Okay, Chapter 16, Calculations for Day Supply. So after you read through this chapter, and after completing the chapter, the student will be able to explain why pharmacy technicians in community practice perform calculations for day supply, explain why the same drug in the same quantity could last different amounts of time for different patients, explain how to calculate day supply for prescriptions for tablets, capsules, and oral liquids, explain how to estimate day supply for eye drops, ear drops, creams, and ointments, explain how to calculate day supply for meter dose inhalers, specialized dosing packs, and insulin, perform day supply calculations for prescription tablets, capsules, oral liquids, insulin, and meter dose inhalers, and estimate the day supply for prescriptions for creams, ointments, eye drops, and ear drops. Okay, so we did this last semester with a little worksheet, so I'm not going to go actually through the chapter, but I'll just start going through some of the practice questions. So number one, of course, is on page 125. Okay. It tells you that Zantac, 150 milligram. You're giving them, of course, 60 tablets, and they're to take it 1 BID. So just make sure that you know, of course, your um, abbreviations. So they're taking, of course, 1 twice a day. So you would do 1 times 2. Okay, so that's 2 twice a day. Then you're just going to, of course, take your 60 total tablets, divide it by how many times they're taking it per day, divide by 2, and you come up with 30. So the day supply of this prescription will last the patient 30 days. Number 2, of course, this one, of course, is augmentin 500 milligrams, number 42 total tablets. So they're taking 1 tablet 3 times a day. Okay, so 1 times 3, of course, it's 3. So it's be 42 total tablets, and you divide by how many times they're taking it per day. In this case, they're taking it 3 times a day. So 42 divided by 3 would be 14 day supply. Okay, we'll skip because 1 through 5 is about the same way. We'll skip down to number 6 because it's referring to cream. And you have Lamisil cream, 15 grams of that cream. You're going to apply, okay, apply it daily, once a day. Okay. So if you notice in the parentheses it says hint, with the creams and the ointments, you're going to use 1 gram per application. So if it's 1 gram per day, okay. So you take 15 grams, and since it's just 1 gram per day, you divide it by 1 because it's only 1 time a day. Then it should be 15. So 15 days supply. So a 15-gram tube of ointment or cream would last 15 days. If it was a 30-gram, it would last 30 days if they were doing it once a day. Some medications, like in number 8, will actually already have if it's in a pack, it'll actually have already a day's on supply on there. So if you look at number 8, you have a Z pack, 500 milligrams. So you're supposed to take on the first day of therapy, you're going to take 500 milligrams on the first day of therapy, which is 2 tablets. Then you're going to take 250 milligrams once a day for 4 days. Okay. But the total cumulative dose is 1.5 grams. So you're just looking here, it already tells you in the thing, it says 4 days you're going to be taking 250 milligrams, and on day 1 you take 500 milligrams. So right there tells you that in 5 days that they're going to be completed. Okay, so that one's just reading it. So just 5 days. So you want to always check the product labeling or see the product packaging. Sometimes will have its day supply already on there for you. Number 9, you have Tylenol number 3, dispense 30 tablets, and it says take 1 to 2 every 4 to 6 hours as needed for pain. Okay, so first we want to figure out, how many is the maximum, of course, that they're going to take, okay, in a day. So between 1 and 2, the most is going to be 2, so you have 2 times. Then we're going to multiply that by how many times per day. So the most that they could take it, or the quickest, is every 4 hours. So then you take 24 divided by 4, and that's going to be 6. Okay, so they can take it 6 times a day if they did it every 4 hours. So they just multiply the day's supply together, 6 times 2, so they can actually take up to 12 tablets a day at the most. Okay, so then you take 30, and then you're going to divide it, of course, by 12, and you get, of course, 2.5. So it'll be 2.5 days supply. Okay, now if you go to page 126, I'll do some different ones that are odd. Okay, number 11, you have Terrazol 7 cream, 45 grams. Insert 1 applicator full, which is 5 grams, at bedtime. Okay, for this one, of course, you have 45 grams. And I'm going to show you this for one reason. You would actually divide it by the 5 grams at 1 applicator full, 5 grams at bedtime. That would actually work out to 9. But if you notice, be 9-day supply. But if you notice in the back of your book, it tells you, of course, that it's 7-day supply. And that's because the Terazol 7 is, the doctors, of course, are going to prescribe it for 7 days. So in the back, it'll tell you that although the weight of the cream in the tube could last for 9 days, the doctor has only prescribed the cream for 7 days. Okay, next, number 12. You have Lacthydrin, 12% lotion, 150 milliliters. So we know we have 150 milliliters total. Apply the lotion twice daily to the affected skin areas and rub it thoroughly. So hint, you use about 1 to 2 milliliters for amount used per application, unless you know of a larger area that's being used. But that's just, I guess, the normal use of it. Okay. So what you would do, of course, is you're going to apply it twice a day. And I'll just do it like this. You're going to divide it by 2 times a day times 2 milliliters. So if you was to do it for the maximum amount they could do, and of course you multiply those two together and you get 4. So then it's really 150, of course, divided by 4, and you should get 37.5 days supply. In your book, they do it over again with if the patient was only taking it 2 times a day times 1 milliliter, be 2. So it'd be 150 divided by 2, of course, be 75 day supply. So in your book, in the back book, it tells you 37.5 to 75 day supply. But in a pharmacy setting, you would always use the maximum amount that patient could take. So we would go by the 37.5 day supply. Okay, next, number 13. That is another one that the RX is really written for 5 days. So the Metro Gel, that's just one you'd have to read the package on. But it says 1 applicator full intravaginally twice a day. It doesn't matter because it's a 5-day supply anyway. Let's see here. Number 15. Factor band ointment. Of course, you have 15 grams. Remember, it's usually 1 gram per day with those ointments and the creams. So you're going to apply a small amount to the affected area 3 times a day. So it's 1 gram times 3 times a day. So we multiply that to be at 3. So 15 divided by 3 would give you a 5 days supply. Another one, number 16. I want to do this one because it's a little bit confusing sometimes with insulins. It says Humulin in units, 100 units, in 10 milliliters. Okay, so it would be 100 units in 1 milliliter. So you would times this to get the total amount. So the total amount would be 1,000 units. Okay, so this one, the total units is 1,000. So then you're going to take 1,000 units. So they're going to take 35 units subcutaneously daily. So it'd be 1,000 units divided by 35 units. Okay, and then your day supply would be 28.5. Okay, and that's with all the insulins. If it's asking for units, you would multiply the units 100 times how many milliliters is in the bottle. In this case, it's 100 units per bottle. 1,000 units, excuse me, per bottle. Okay, so what I'll do is I'll just let you practice through the rest of those. If you have any questions or concerns, please send me an email or make an appointment with me to talk with me in the office and I can go over the problems with you.